Hello, my name is Melanie Hardy. The aim of this project was to reduce oral pressure injuries and improve documentation. The focus was on improving patient safety by standardizing endotracheal tube, ETT or ET tube repositioning to reduce oral pressure injuries. The project was scoped at Intercommunity Hospital, a 193-bed acute care facility within the Emanate Health organization, featuring 8 surgical ICU beds and 14 critical care beds. There are 3 hospitals in the system, but I wanted to focus on just one facility, specifically the smaller critical care units, where communication and monitoring can be emphasized more freely and readily. It is important to prioritize quality improvement in critical care units, as those patients are more fragile and susceptible to infections. The need for this project came from a general observation of an increase in oral pressure injuries. Documentation audits confirmed inconsistent ETT repositioning, necessitating a change. When discussed with the respiratory therapy and nursing staff, their feedback supported a need for standardization. The topic for this project was to standardize ET tube repositioning to every 4 hours, to include a skin assessment with each repositioning, and to monitor documentation compliance. There was a dual focus: clinical practice change and documentation monitoring. The ET tube repositioning schedule before this was infrequent, sometimes down to once a day or once every 12 hours. There were 3 major goals of this project. The first objective was to reduce the incidence of oral pressure injuries, as referenced in Holdman et al. 2020. The second goal was to improve documentation practices. And the third goal was to strengthen interprofessional collaboration between nurses and respiratory therapists, as noted in Gleason et al. 2023. Improved collaboration supports both patient outcomes and staff accountability. As with any attempt to change, barriers were noted. They included competing priorities, such as patient transports, bedside procedures, and patient instability. These barriers could occupy time not part of routine patient care. These barriers sometimes cause delayed or missed documentation. Staff workloads and other time constraints also contributed to delayed or missed care or documentation. Good and appropriate oral care was often the first thing to be triaged if staff became busy with patient care. When discussing with staff the importance of oral care and consistent repositioning of the ET tube, most needed to be coached repeatedly to understand its importance in preventing injury. I found that none of them wanted to hear about the negative financial or regulatory impact on the hospital that these injuries could have. The appeal needed to be more personal and relatable, as if to imagine the patient was their family member and they got a preventable injury that added trauma, pain, and time to their experience in the hospital. Sometimes I even had to ask the staff member, what if that was you lying in that bed and had a bleeding open sore on your lips or gums caused by that breathing tube you don't want in your mouth in the first place? Some people needed to hear it in that reference to get them to understand the import. The implementation process included education for the ICU staff, including respiratory therapists and nurses. This was most important for them to understand, as collaboration would help with buy-in to the project and potentially create positive outcomes. It was reinforced that the ET tube should be repositioned every 4 hours, and this process must include a thorough check of the skin and oral mucosa with documentation. When RTs moved the ET tube and performed a skin assessment, that assessment needed to be done with the nurse at least once a shift and documented as such, including the nurse's name. Side note, that data was not tracked. Medical records would be consistently audited for documentation compliance, and staff members would receive regular feedback and coaching to ensure ongoing improvement. The project's outcomes were positive, but less dramatic than anticipated, as practices were already fairly strong. It turned out that the RTs had already started repositioning the ET tube every 4 hours, for the most part, but their documentation wasn't consistent. Improvement was incremental and mostly centered on documentation. Outcome data is on the next slide. Official project implementation began in July. The population of patients to be monitored was limited due to exclusion factors, which included length of intubation of 5 days or greater. Since it is always in the interest of patient care to remove a patient from the ventilator as soon as possible, the number of patients who qualified was limited. In the top graph, prior to the project, the documentation of ET tube changes was done every 4 hours, with only 4 instances of error. Most of the missed documentation was completed by a single person, who received continued feedback and coaching. After implementation, there were only 2 errors committed by a single staff member, who received feedback and education, and the reinforcement was effective. Although the results were not statistically significant, the outcome was still positive, and staff documentation improved. They became more conscious of its importance to patient care and patient safety, and buy-in to the goals was well understood. Additionally, no adverse events resulted in patient injury during the study period. Nursing and respiratory therapists, the primary stakeholders, received the information and instruction on this project positively. They were greatly interested in a change that would improve the prevention of patient injury. Nurses, in particular, wanted to see improvement because they are the ones whose workload is more burdened when there's an extra injury. Leadership also strongly supported the project, resulting in buy-in to shared goals, as noted in Kaiser et al. 2022. Leadership has a better understanding of the financial and regulatory implications for an organization, so any chance to improve the numbers is supported. To maintain these changes sustainably, leadership support is necessary for ongoing monitoring, and monthly reports are needed to track progress. The changes also need to be incorporated into orientation for new hires. This practice of oversight and accountability, as noted in Perry et al. 2018, will ensure that the changes will continue beyond the initial project. The next steps include being handed off to the department supervisors and directors. Supervisors or their designees will be trained to audit the documentation and oversee compliance. They will also collaborate with the performance improvement teams to sustain progress through tracking data and analysis. PI will generate reports, and the department designees will present them to quality assurance committees and other committees as applicable. Once this process is in place, it can be included at the 2 sister hospitals in the organization. My personal professional goals during this initiative included developing and leading a quality improvement project as described in Campbell 2023. I also wanted to build trust with the staff I don't oversee, which are the nurses, as there's already good foundation of trust in place with the respiratory therapists I do oversee. This trust fosters buy-in to the goals and strengthens leadership, collaboration, and coaching skills, as noted in Richardson et al. 2023. I anticipated seeing a greater statistical improvement, but this may need to be achieved at one of the other hospitals with a larger critical care population. The lessons learned during this time were that the staff were receptive to coaching, as referenced in Zarin et al. Of 2023. The respiratory team was already practicing Q4-hour repositioning, but it was inconsistently documented. Positive results were achieved through teamwork, effective communication, and a culture of accountability. In conclusion, standardized ET tube repositioning enhances the consistency of care and patient outcomes. Sustainability depends on leadership, regular audits, and ongoing education. The project highlighted the importance of teamwork, effective communication, and coaching in achieving quality improvement. Staff buy-in and a greater understanding emerged when education was more personal and relatable. These next two slides are my references. Thank you for your time and attention.